Good afternoon, and thank you for joining us today for the latest update on the 2019 novel coronavirus, or COVID-19. I'm very pleased to be joined today by Randy Padfield, the Director of the Pennsylvania Emergency Management Association, and Neil Weaver, the Executive Deputy Secretary for the Department of Commerce and Economic Development. Thank you. Got it all right. As of 12 a.m. this morning, we have 96 Pennsylvanians who have tested positive for COVID-19. All are either in isolation at home or being treated in a hospital. A county breakdown of cases is available on our website at health.pa.gov. We are now getting reports of test results from commercial and hospital laboratories, as well as our state laboratory. And as of 12 a.m. this morning, 879 patients have tested negative for COVID-19. We have made changes to the way that we are reporting cases of COVID-19. We are reporting new cases and negative tests once a day because the volume of test results coming into the Department of Health continues to increase. Any results reported after 12 a.m. will be reported the next day. Most Pennsylvanians now are being tested through commercial or hospital laboratories rather than our state laboratory. As a result, we do not have comprehensive numbers of the people who have been tested or number of tests pending. Our teams are working to determine how each person who has tested positive for COVID-19 became exposed to the virus whenever possible. For the majority of cases, we have been able to trace where they were exposed. As this outbreak continues and commercial and hospital testing increases, we are actually less able to track all of these exposures because of the numbers. At this point, we can assume that there are people whose exposure we cannot trace back to a known source. However, we are not yet seeing what is called sustained community spread. However, we do expect that sustained community spread will happen in Pennsylvania, which makes the measures that Governor Wolf announced so essential for protecting all of our residents in our Commonwealth. Now, here are some things that you can do to help. Please donate blood. Local blood banks are asking for residents to continue to donate blood. They have precautions in place so that you can donate blood safely. Please donate to food banks. Many Pennsylvanians are not able to stock up on supplies, and they rely on food banks to sustain their households. Please call on seniors in your community to make sure that they have what they need. The Department of Aging and the area agencies on aging are working to make sure that seniors still can get the supports that they need through senior and adult day centers. Please stay home. Your job right now is to stay calm, stay home, and stay safe. As our Commonwealth moves forward through this outbreak, it is important to know that there are mental health resources that are available. If you or someone that you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741. Now, here are my daily reminders. Wash your hands with soap and water for at least 20 seconds, the time it takes to sing Happy Birthday twice. And use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not your hands. Try not to touch your face, especially after you've touched a surface. Clean surfaces frequently. And if you are sick, please stay home until you are feeling better. Practicing these everyday prevention measures can help slow the spread of COVID-19. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. As this situation evolves, we will continually update Pennsylvanians through our website, our Facebook, and our Twitter account, as well as regular press releases and press conferences. If you have questions about your health, please contact your healthcare provider. We have been updating providers on how to assess patients and with the current information about testing. What is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. Thank you. And now we'll be listening to questions.
Thank you, Secretary. The first question is for Neil Weaver from DCED. These are questions around businesses. Several reporters are asking, what is an essential and non-essential business? How do we decide that? And if they're not sure, what should the owner do?
Absolutely. So the distinction was made that it was chosen based on businesses that focus on the health and safety of Pennsylvania citizens. I will list what we have on our website as non-essential and essential services. We'll start with essential services, and sectors include but are not limited to food processing, agriculture, industrial manufacturing, feed mills, construction, trash collection, grocery, and household goods, including convenience stores, home repair, hardware, and auto repair, Pennsylvania's pharmacies and other medical facilities, biomedical and healthcare, post offices, shipping outlets, insurance, banks, gas stations, laundromats, veterinary clinics, pet stores, warehousing, storage and distribution, public transportation, and hotel and commercial lodging. We also have a list of non-essential business, again, on our website. These include public-facing industries, such as entertainment, hospitality, and recreation facilities that include and not limited to community and recreation centers, gyms, including yoga and spin facilities, hair salons and barbershops, nail salons and spas, casinos, concert venues, theaters, sporting events, and golf courses, as well as retail facilities, including shopping malls, except for pharmacy or other healthcare facilities within retail operations. And any businesses that have questions about whether or not they are essential or non-essential, we are asking that they reach out to our office at DCED at ra-decedcs@pa.gov. Also watch our website for updates and continuous updates to that.
Secretary Levine, we have a question about shortages of PPE. If hospitals begin to have shortages of personal protection equipment, will the state health department be able to ship more from the federal government? If not, how will the state government hospitals address this problem?
Sure. So as this epidemic of COVID-19 progresses, it will put strains on our hospitals and health systems. And so they have their own stores of personal protective equipment, including the N95 masks and other type of equipment. But if they are running short, the Department of Health also has stores of personal protective equipment. In addition, the federal government has its own stores of personal protective equipment that we can draw on if the Department of Health is running out as well. So we will certainly work with hospitals and health systems and all healthcare providers to provide the necessary protective equipment as much as possible.
We have a question for Director Padfield from Ford Turner and Sarah Ann Hughes. Please describe plans for 2 mass testing sites that lawmakers have told us will be opened in Philadelphia and Montgomery counties, and explain, if you can at this time, which populations will be allowed to be tested there.
So currently, as people may be aware of, the concept of doing mass testing sites was released, obviously, across the nation. So we're taking a look at establishing 2 of those that will be federally supported, one in Montgomery County and one in Philadelphia. Currently, we're taking kind of the high-level concept of operations and working to operationalize that right now. So we're taking a look at site selection and those types of things. The goal of those 2 sites are really to test folks that fall within a certain symptom range. And Dr. Levine can comment on that a little further, but really they're testing folks that have certain symptoms that would lead us to believe that they may have COVID-19. So that is really key associated with those sites. So if people are well, we're usually going to message people not to go to those sites. There are a number of other sites that are being established by healthcare systems and things like that that will be able to handle the testing surge. But those 2 sites are really predominantly for people that are showing symptoms and believe they may be afflicted with COVID-19.
This next question is for Neil Weaver. Neil, the question we're getting a lot is in terms of enforcement of businesses staying open. Could you address that a little bit?
Sure. We are asking businesses to take a common sense approach to this and to follow the governor's directive. We don't think, and the governor does not believe, that this is the best use of our public safety.
Secretary Levine, with liquor stores closing at 9 p.m. tonight, what provisions has the state made for people who are dependent or addicted to alcohol? Severe alcohol withdrawal can be deadly. As the state opened up more detox beds for these people, this is coming from Aubrey Whelan from the Philadelphia Inquirer.
Yes, that's a very important question. And actually, we have a phone call with Secretary Jennifer Smith of the Department of Drug and Alcohol Programs to come up with a plan for patients who are addicted to alcohol and would suffer if and when the liquor stores are closed. So I don't have the details of that plan, but we're talking about that this afternoon because it is very important.
Director Padfield, this is from Mark Levy at the Associated Press. How many public testing sites do you envision? Where will they be and how will they work?
So currently the plan is to have 2 public testing sites, one in Montgomery and one in Philadelphia. They are originally designed around the concept of a drive-in or drive-through site based on the federal model and the concept that was essentially laid out. Like I said before, we're still working on operationalizing those, but there will be a number of other sites that will be stood up by healthcare systems as testing becomes more available.
Neil, Ed Albert from Fox 43 would like to know if there are people laid off because of COVID-19 and collect for, say, a month, will that count against if they are laid off later in the year? In other words, for unemployment compensation, or will they only be eligible for 5 months?
I don't understand that, or not, I'm sorry. I don't know the answer to that question. We'd have to direct that to Department of Labor and Industry.
No problem. And Secretary Levine, question from Ed as well as what guidance has been given to dentists around COVID-19 in Pennsylvania?
So dentists are at significant risk of exposure to COVID-19 just in terms of providing dentistry and doing dental procedures. So we have been working with our state dentist, Dr. Mana Masfarian, to work out guidance, and we'll be working to release that guidance this week.
From the Philadelphia Inquirer, Dr. Levine, Marie McCullough would like to know other states are separately reporting private, commercial, and academic lab results. How many PA residents have been tested by private labs, and how many were negative, how many were positive? And then to get a swab at a state-sponsored collection site, will the patient have to have symptoms and a doctor's prescription?
So I don't have that detail of who has been tested at our laboratory versus who have been tested at commercial or the health system laboratories. I don't have that information. As Director Padfield was talking about, at the 2 sites, we're going to be prioritizing patients. We're going to be prioritizing certain sets of patients, such as healthcare workers and seniors, et cetera. And so what we really want to do is to have people who have symptoms symptoms or are worried to call their healthcare provider. And a lot of testing now will be done through the commercial laboratories and the health system laboratories. And we're also prioritizing specific groups for our state laboratory. The goal is putting all of those together to provide testing for the individuals and the citizens of Pennsylvania.
This is for Director Padfield. Vice President Pence requested construction companies donate N95 masks to hospitals. Do you think construction companies in PA should be doing this to help? Secretary Levine, you may also want to follow up.
So we've actually investigated this with our public-private partnership. And obviously, with the strain that we anticipate on personal protective equipment, this is something that we're actually taking a look at. We know that there are a number of companies out there that have the capability and have the personal protective equipment. So right now, we're kind of working down through that. That would be a very plausible idea to be able to help augment what we would need to be able to surge that to the healthcare community. So currently, that is something we're working through to find out what is actually available in those private sectors.
And Director Padfield, this is for you also. Ed Mann from PA Post would like to know, have any National Guard units been called up for service in response to coronavirus or put an alert to be called up?
We're actually working with the National Guard on a regular basis. So they're a partner of ours during fair weather and also during times like this. So we're really evaluating what we need and what the components happen to be. Currently, we have National Guard personnel in our Commonwealth Response Coordination Center. They are assisting in any one of a number of operational planning groups to be able to take a look at some of the complex problem sets that we're going to have with a situation like this. So we reevaluate that daily because it's a very dynamic situation, and we call National Guard up on the state active duty as needed.
Secretary Levine, this is from Amy Kem at WHTM. Many patients with mild symptoms report being told by doctors to simply stay home and not be tested. How then will the CDC have the correct total number of cases?
So as we go from the containment phase to the sort of the beginning of mitigation to further in terms of mitigating and the spread of COVID-19 in Pennsylvania, we really are recommending that people stay home, that people not go out, as we've been doing, closing businesses, etc. And so if someone has no symptoms, please stay home. If someone has very mild symptoms, maybe a little congestion, I really recommend that they stay home. It is important to get accurate numbers, but it's actually more important to prevent the spread of COVID-19. So the recommendation actually from the federal government recently announced is if you have very mild symptoms, just a little congestion, stay home.
This next question, Secretary, is for you, from Mark Scolforo from AP. What information are you getting from hospitals about the number of new patients and their capacity to treat them?
So we are working very, very closely with hospitals. We're working very closely with HAP, the Hospital and Health System Association of Pennsylvania, to determine the capabilities of the hospitals and to make sure that they have the equipment and the supplies that they need to deal with ill patients that will be arriving with COVID-19. We have not seen that any hospitals or health systems are overtaxed at this time, but we want to be prepared for any eventuality. So a lot of the work that we're doing right now is that type of preparation.
Secretary, this is from Sarah Bowden from 90.5 WESA News in Pittsburgh. If a healthcare provider is concerned with how the employer is handling the crisis, what should that healthcare worker do?
If a healthcare worker is concerned about the employer, then I think that it would be fine to notify the health department. So, we would work with DCED and other administration agencies to discuss that. In the Pittsburgh area, you would notify the Allegheny County Health Department, and they could work with us and DCED and other agencies to check on that.
This is from David Wenner at the Patriot News for Secretary Levine. Are we seeing any strain at hospitals because of coronavirus cases? If not, what is your prediction on how likely surge is and when will it come?
So we are not seeing any strain on hospitals and health systems at this time, but it would not surprise us if we do start to see increasing numbers probably next week and the week after. And so, again, we are working to prepare for that if it occurs, and working with the hospitals themselves and with the hospital association.
And from Secretary from Ford Turner at the Allentown Morning Call, is community spread happening now, at least on a limited basis, in Montgomery County or nearby counties?
So as I talked about yesterday and today, there are a number of cases where we cannot determine how those individuals were exposed to COVID-19. And so I guess the term I would use is that there is probable limited community spread of COVID-19. But the most important question from a public health perspective is there sustained community spread in that area, which is much, much larger, and there is not at this time.
Thank you so much. Any questions from reporters that we were not able to get to, the Department of Health and the Governor's Office will follow up with you. Thank you for tuning in to our broadcast today.
Thank you very much.